Greenleaf Education Costa Rica is our for-profit company. We do environmental education courses, environmental leadership, environmental analysis and problem solving, stuff like that. We're just now launching. We built all this over the last 2 years. We're off-grid solar here, so this is coming directly out of the sun. This electricity is coming from a solar array right there on that roof. Then we also have Fundación Esperanza Aplicada, the Applied Hope Foundation. This is our nonprofit formed under Law 5337 of Costa Rica. And the goal there is to have a very open, welcoming place where people can come and bring environmental projects, learn, do entrepreneurship, green entrepreneurship. We just acquired the land across the road, and we'll be doing an organic agriculture lab over there. So we'll be producing organic veggies and edibles, but also trying to add a science component to it so that people can replicate that and do that over and over again. So we'll have a real open. This is our soft open, but we'll have a real open, I hope, before Christmas, and we'll definitely invite you all, so please sign up. Also, Diane does massage, so her cards are right there on the table if you want a great massage. Some of you have already had them. Right, so anyway, this is my life's work and a dream come true, and so seeing you all here makes me... Okay, so snakes. All right, so what's interesting, a lot of my interest in environmental work is because wherever there's environmental degradation and pollution, there's poverty. Poverty and environmental degradation are evil twins. They go hand in hand everywhere in the world. And that's something I hope through this place people can come here and help address that. And one place that's very true is snakebite. Snakebite is a tropical disease and a public health issue. Here in Costa Rica, we're fortunate. You know, Costa Rica actually exports antivenom. And here, basically, every clinic has the antivenom you need in case you encounter a venomous snake. But through much of the world, that is not true. All over Africa, South Asia, even Latin America. And it's really a disease of the poor because, you know, campesinos, people working in challenging situations. So here's another example of where the people who can least afford it are the people who suffer from it. And Ray and his groups, the groups he works with, are doing really important work, not only in researching snakes, but also in trying to increase the level of care that people can receive when they do get a snake bite, access to antivenom. It's very important work, and I think it's borderline, I think it's quite heroic work that they do, and really important. So, without further ado, Ray Morgan.
Wow! This is wild. I was not sure we were going to have this many people at a new facility, but I'm stoked to see you guys here. So thank you, first of all, to Stephen for putting this together, for volunteering the use of this facility. Thank you to Diane as well. Thank you to Elizabeth for suggesting that we do this again. We used to do this pretty regularly when I lived here. And now it's been, I think, about 3.5 years since the last one we did. So I see mostly new faces. Probably 2/3 of the faces here I don't remember meeting before. So what are we going to do? The next hour, well, I'll introduce myself first. I'm Ray, if you haven't met me. I have worked in and around herpetology and herpetoculture since I was about 7 years old, which was at least, I don't know, 20 years ago. So I work with an organization that Stephen mentioned called the Asclepias Snakebite Foundation and the African Society of Venomology. These are consortiums of foreign and African medical professionals that deal with, we work with them to teach them to use antivenom for snakebite. And I don't want to spend too much time on Africa, but as Stephen mentioned, it is a disease of poverty. The clinics that we build over there reduce fatalities by about 90%. And you can do that with about 2 weeks of training, some basic supplies and antivenom. You can reduce fatalities by about 90%. It is pretty amazing. At the other extreme, you have places like Europe and the US where snakebite is largely a solved problem. It just isn't it's not a significant problem. Then you have Latin America, which is kind of in the middle. We have a much bigger problem with snakebite injury and fatality than per capita than the US does. We'll get into that in detail. Also, if you know anything about a film called the Venom Interviews, that was me. And when I used to live here, I was the guy that you would call to get terciopellas out of your yard and out of your house and things like that. Okay, so what we'll know, an hour, 90 minutes from now, I'm going to spend some time around about what lives around the lake. We have about 145 plus or minus species of snakes in the country. We have about 40 or 50 of those around the lake, depending on how far out you go. You only need to worry about 4 or 5 of them. So you'll know how to identify those better by the time we get there. I'm going to make you a promise that nobody here will ever be bitten, ever, if you follow 2 simple rules, which we'll get to. We'll talk quite a bit about snakebite, what to do, what not to do. We'll hit briefly on some of my favorite fairy tales and fiction. Snakes are surrounded by mythology and nonsense, and you think fish tales are bad. Snake stories are their next level. And sometimes I even hear them in these presentations. So usually what I'll do is I won't embarrass somebody. Somebody tells me a story or something you heard. I won't say, that's the stupidest thing. I'm not going to do that to anybody, I promise you. I might say something like, I've never seen that happen, or something like that. The way we'll do Q&A, I'm not going to save it to the end. Throw up your hand at any time, ask a question. Once I leave a topic, I probably won't come back to it. If we're coming up to it, I'll say we're coming up to it and remind me when we get to it. Otherwise, we'll just go. All right, so let's start out with a quick true or false. Costa Rica has no gorillas. Okay, I've been asked where the gorillas are. Costa Rica has no gorillas. No elephants? No, okay. No boa constrictors. That's actually true. No fritilances. That's also true. And okay, those 2 points, you'll know by the time I finish, you'll understand what I mean by those. Okay, Costa Rica has no poisonous snakes. Unknown. Unknown. Okay, the one distinction I'll make, and it's pedantic, but it's fun, so I'll talk about it. Poisonous means something is toxic if you eat it. Okay. Meaning the toads and frogs we have, if you eat those, they're poisonous. Their toxin is delivered. The plants you would eat are poisonous if you eat them. Venomous is things like ants and wasps and snakes and cone snails and scorpions and things like that produce a toxin and inject it into you via a stinger or fangs or something like that. So, do we have poisonous snakes in Costa Rica? It's unknown. We probably do. There are a couple of the snakes that eat some of the toxic frogs. And some of the snakes that become poisonous are poisonous because they sequester toxins from the things they eat. A friend of mine who was working on that here in Costa Rica unfortunately passed away a few years ago, and that work was left unattended. So the answer is today, do we have poisonous snakes here? Probably, but we don't know for sure. But venomous snakes, we absolutely do, and we're going to spend plenty of time on that. Okay, so what, yes sir?
I think you're wandering so far forward, you're out of frame.
Okay, so what lives here? All of these pictures are pictures that I took while I lived here. All of these are immediately around the lake. In fact, almost all of these are snakes that I either found at or around my house or that I was called to remove. Okay, everything on the left side of that red line, those are all harmless. Those are all, not all of them, but there's a lot of the harmless snakes you'll find around here. On the right, we'll spend a little bit more time on the venomous stuff. Yes, sir.
Is it possible to move that more into the middle? Because we're having a hard time seeing it.
Let's see. Can we move it about a foot? Is that okay? All right. How does that look? Can you guys see it? Okay. Hold it up, hon. All right. That's about the best I'm going to get. I'm sorry. Okay. So we're going to spend a lot of the time on the right side of that red line with the snakes that are venomous because for the most part, I think that's why all y'all are here. Okay, so let's dispense with 2 myths right off the top of the head, right off the top of my head. Okay, vertical pupils in snakes mean the snake is, it means it's nocturnal. It has absolutely nothing to do with whether they're venomous or not. Okay, this is one of the rules that people would bring down from the US. This is the tropics. Everything here is nocturnal. Lots and lots of stuff has these pupils. This up here is a tree boa, totally non-venomous. This is a king cobra, one of the few snakes in the world that could have you in the ground and cold by dinner time. And that has these big, harmless-looking eyes. Okay, what about head shape? What can you tell about a snake by the shape of its head?
Usually a triangular head is the one that has big teeth, which means probably venomous.
That's good logic, except it doesn't work that way. So in some areas, so in the US, for example, it's true more often than not that the pit vipers do have larger heads. The harmless colubrid snakes have smaller heads generally. We are not in Kansas anymore. This is not, any rules that you brought with you don't apply here. Look at the silhouettes of these heads here. Could you pick out which ones are venomous or not? Okay. How about now? Okay, so we've got snakes with big triangular heads that are totally harmless, like this guy here. We have snakes with fairly round heads. That's a neotropical rattlesnake. Our rattlesnakes here have relatively small heads. That's a coral snake. Coral snakes have little tiny heads. So you can't really tell much at all about head shape. So you don't have eyes, you don't have head shape to go with. You actually have to learn to identify each individual snake based on its characteristics. The good thing is you don't have that many to learn to identify. Here on the lake we have 4 pit vipers. We have 2 or 3 coral snakes depending on how far out you go. 2 of the coral snakes look the same. One of them you're probably never going to see. But we'll spend some time on coral snakes. You're going to be good at identifying coral snakes by the time I'm done. Okay, so let's start with these. All of these are Costa Rican species. So one of the rules that a lot of people bring with them is this idea that you can identify coral snakes, or you can differentiate them from non-venomous mimics by the sequence of colors. There's a rhyme that you hear, red on yellow, kill a fellow. Forget that you ever heard that. Because it doesn't apply anywhere in Latin America. Now, unfortunately, you'll hear another rule here. It's called the Rana rule. Rojo, amarillo, negro, amarillo. Red, yellow, black, yellow. That is supposedly the way you would identify coral snakes here. That doesn't work either. And unfortunately, that comes from even places like Clodomir picado, who produces our antivenom. That doesn't work here either. The 2 bottom are examples. This guy, Mycurus multifasciatus, is a bicolored coral snake. Mi partitas is down in the Caribbean coast, also a bicolored coral snake. Those don't follow that rule. The ones where red and yellow do touch, up at the top, we're going to see some examples where we have perfectly harmless snakes that have that exact same pattern, and they're legitimately difficult to tell apart. Okay, but I'm going to give you a couple things to look for. Okay. I'm sorry? Okay. I'm going to try to speak over the parrots. All right. Okay, so there's a bunch of other myths about coral snakes. Let's dispense with these right away. First of all, they're not rear-fanged. How many of you have heard that coral snakes are rear-fanged? You haven't? Oh my God, good. Maybe. Yeah. So you'll also hear that, well, their mouths are so tiny they can only get you between the fingers, or they have to chew. Oh, that's all nonsense. They eat other snakes. Their fangs are enough to get through the skin of other snakes, which is thicker than your skin. Pretty much any exposed skin, they're able to bite. They are not inclined to bite, fortunately, but if you grab them or step on them barefoot, as soon as they feel restrained, they will turn around and let you have it. But other than that, it's pretty hard to trigger a bite response from them. The other thing I want that you're going to hear me emphasize throughout this talk is the difference between venomous and dangerous. Venomous and dangerous are not the same thing. Most snakes that are biologically speaking, physiologically speaking, venomous are totally harmless to people. So you'll hear me draw distinctions between medically important or harmless. Medically important means it's venomous and it's enough to be a threat to life or limb. Harmless means it's either totally non-venomous or it's a rear fang species, it's just nothing to worry about.
Can you explain rear fang?
Rear fang, yes. I think we'll have some pictures of it, but I'll describe it. Front fang, let me go back one. This is a skull of a coral snake. You notice its fangs are actually the frontmost teeth on its outer rows, its outer maxilla. So snakes on the top have 4 rows of teeth. The fangs in front fang snakes are in the first position on that outermost row. In rear fang snake, it's the last tooth, which falls right about under their eye. So it's not literally at the back of their mouth. It's about, if this were a rear fang snake, the fang would be right about there. Okay. What rear fang snakes also have in common is generally their venoms are not especially toxic. They have them in very small quantities, and their delivery system is not very well developed. So they can't get much into you. They're just not. They're not a very efficient or effective envenomator. Okay, so let's talk about some of the coral snakes. And there's a few things here I want you to look for. The top left here, this is one of the many species called false coral, coral falsa. Here you'll have all kinds of snakes referred to as coral falsa. Coral falsa doesn't refer to any particular snake. It refers to anything that looks like a coral snake. Okay, so this one up here is a snake called Erythrolamprus bizona. It's fairly common here around the lake. Eats mostly other snakes. Looks almost exactly like what we have here called a tropical king snake or a milk snake. They look almost identical. There's only these white speckles on the outside of the black rings are a thing that differentiates the two, but in any case, it's totally harmless. This here is another little snake that's fairly common. It's called Tantilla supracincta. I don't think it has a good common English name. It's a little crown-headed snake or something. They usually 12, 15 inches is about as big as they get. Those are pretty common. This guy down here we'll spend a little bit more time on. We'll come back to that. This is a snake down in the South Pacific. This is one of the cat-eyed snakes that looks a lot like that bicolored coral snake. They're totally harmless. This guy, let's spend some time on this one. This is a snake called, it doesn't have a good common name, so I apologize in advance, Scaphiodontopus venicissimus. So notice that this does have red and yellow together. As an adult, as a baby, they're solid brown, and that pattern changes up the body as they age. But the adults look like this. The adults look convincingly enough like a coral snake that if I didn't have my glasses on, I wouldn't pick one up. They're that convincing. But there's a couple things that I want you to look for here. One, notice that their nose is white or light colored, but they also have this broken pattern. There's areas where the bands are kind of disjointed. That is common in a lot of the tricolored snakes that we call false coral snakes. It almost never happens in true coral snakes, so it's very common in all of the species here. If you see those bands, it doesn't just stop at the dorsal midline at the spine, but it shifts a little bit. That doesn't happen in coral snakes, so it's a good indication. So that's one thing I want you to look for. Okay. Now, another thing is that occasionally you get coral snakes that are atypical. They're not patterned like a typical coral snake. You have things like, well, let's go from the bottom up. You have albinism, where the black pigment is missing, melanin is missing, which leaves them white or pink in the areas that would normally be black. You have melanism, which is kind of the opposite. It's an overexpression of melanin, where the entire snake can be almost completely black. Neither one of those really look like coral snakes. Before I go on to that last one, I'll mention that I did get a call for a snake in Lebanon, I think. It was a true coral snake that had a very rare mutation. It's called anerythrism. It's where the red pigment is missing. So instead of red and black and yellow, you had black and white and yellow. That's very unusual. There's some places where these mutations are common. Melanism is super common in coral snakes in central Texas. None of these is super common here, but we do get occasional weirdly patterned coral snakes. Now, the one up top is where the pattern genes just completely went haywire. It lost its bands almost completely, and it just looks like a bizarre red snake. So for that reason, you don't want to just rely on color or pattern to identify anything. Okay, now, how many of you have emailed me? I think somebody here has emailed me about, how do I tell the difference between coral snakes and isn't there some easy rule that I can tell the real ones from the false ones? There are, but my answer is that the reliable rules aren't simple, and the simple rules aren't reliable. So here's an example of that. The reliable rule is the presence of this one scale in between the preoculars and the nasal scale. Okay? Okay. Now, you've got a snake the size of a pencil, and you're going to have to get really close to it to examine it. Don't do that. That's a bad idea. Another thing you'll notice here is coral snakes have very, very small eyes. Their eyes are small. They're set kind of far forward in the head. In harmless colubrid snakes, you can usually pretty clearly see the pupil. If you can see the pupil, it's not a coral snake. Their eyes are tiny and black. They're a little bit far forward. But they also have this black mask that goes from their nose to right behind their eyes. And that is true of all the coral snakes here around the lake. We have one down in the South Pacific, down around the Osa Peninsula, that's not true of. Here around the lake, all of them, black nose that goes just to behind the eyes. So that's one thing that you want to look for, okay? So broken bands is probably false. Black mask going just to the eyes, probably real. Don't worry about the scale, that's just for fun. Okay. All right, here's the final exam. Ready? Okay, this one, true or false? True. True, good. This one. That's also true. Okay. What about this one? False. Okay, who says false? All right, you're correct. That's false. Notice it's got a little bigger eyes. That black band extends a little bit further back. And they've got this is a dipsis. It's a snail-eating snake. They've got a big, gigantic head. Coral snakes have little tiny heads. Okay, this guy here. False. How come? Yeah. Oh. Right, so it's got the disjointed bands here, and it doesn't have that black mask over its nose. Okay, you feel good? Oh wait, there's more. Okay, how about these two? Let's do that one first. True or false? Because why? Okay, it's got these broken bands. Excellent, and it doesn't quite have that mask that we're looking for. How about this guy? Also false. Okay, both of these are false. Both of these are common around the lake. Okay, everybody feel a little bit better about being able to differentiate them?
Why is the second one false?
This one?
Yeah.
Okay, there's a couple of things. Notice it's got these broken bands here.
That's hard to see from back here.
Yeah.
Okay.
Yeah.
It's not, yeah, okay.
Yeah. Sorry, it is a little bit hard to see.
And the one on the previous slide that was false up in the right corner.
This one.
Right corner, up.
Oh, top right. That's a true coral snake.
It's a little head.
Yeah, it's got the black mask. Okay.
It's got that scale.
Yeah. Well, yeah, you won't be able to see that. Okay. Okay. Here's the one thing that always works. Don't touch them. Okay? Okay. Now, people get obsessed with rules and this rule and that rule. Don't worry about it. Just don't pick them up. Coral snakes, if you don't, about the only way you can get bitten by them is to either step on them barefoot, and if you're out here barefoot, you have lots of other problems to worry about. And if you pick them up with your hands and get bitten, you probably also have other problems to worry about. Don't do that. Don't pick things up.
Are you saying they're not aggressive?
What's that?
They're not aggressive?
No snake is aggressive. We'll spend some time on this when we get to terciopellos. No, coral snakes don't do this. But for the most part, coral snakes, if they don't flee from you immediately, which is what they typically do, okay. If you were to put your hands under a coral snake and just pick it up like this, it's not going to do anything. For the most part, they won't do anything. They're just, as soon as you pinch them or restrain them, that flips their switch and they will turn around and let you have it. But for the most part, they're not that inclined to bite. And for that matter, whether a snake is venomous or dangerous and its inclination to bite are two unrelated things. The one snake here that will always stand its ground and put on an incredible threat display, and if you get close to it, it will bite you, are boas. The common boas here are absolutely non-venomous, and they don't back down. They will just sit there and they put on this fantastic threat display. It's very intimidating. Okay. Okay, we do have some pictures of rear-fanged snakes. This guy here on the right is a parrot snake. You can see these little tiny fangs right back here under the eye. Now, this guy here is this is a special case. So that's a road garter, guardacamino in Spanish. These occur from, they're west of here. They're more toward the dry areas of Guanacaste, but we do see them at that end of the lake. Who's telling me that you live in Green Village now, in Alma? The first one I found, actually this one was on that property. This one also stuck those fangs into this finger, and this is the one rear fang snake we have here in the country that I would take. I treat these like coral snakes. They are not dangerous, probably, but they do have a good delivery system. Look at the size of those rear fangs. Their venom is a pretty potent anticoagulant, which means you get bitten, you bleed and bleed and bleed. My office looked like a crime scene. It took 20 minutes to get the bleeding to stop. They're not really dangerous, but I wouldn't, if a big one, wouldn't let it chew on me. And they're exquisitely painful. Yes?
What was the name of that snake?
This is called a road garter.
Road garter.
Road garter, like a guard. Yes.
So they might be a bit more dangerous if you're on warfarin or a blood thinner.
I can conceive of a situation where somebody had an existing bleeding disorder, was maybe not in great health to begin with, had a large one, and it chewed on them for a good period of time. I could see that being enough to push a fragile patient into dangerous territory. But that's a lot of things that would have to go wrong.
Right. So it doesn't just bite you once, it just keeps biting you?
What some snakes, generally they'll bite and release. Occasionally you'll get a snake that will bite and hang on. The one that got me was just a quick nip on the end of this finger, and it was an attention getter. I've been bitten by lots of stuff. That was probably the most painful, and that snake was the size of a pencil. It was 12 inches long. Okay, all right, now let's talk about the things that really matter. Let's talk about pit vipers. Okay, pit vipers are pit vipers because of this pit they have in between their nostril and their eyes. So this pit is a heat sensor. It faces, the opening faces roughly forward. In some snakes, like eyelash vipers, it's pointed forward almost like gun turrets or something. They're pointed straight forward. They're extremely sensitive to variations in heat, even to the point that pit vipers that are born with it's a rare defect, but it happens where they're born without eyes. They have absolutely no problem feeding, hunting. You'll find them in the wild sometimes. They're at a disadvantage, but they're nocturnal anyway. They're primarily relying on these heat sensors. And as far as we can tell, those heat sensors are part of their vision system. They're part of their ocular system. So if you watch Predator or something like that, that probably is a good approximation of what a snake experiences with these pits. Okay, some other snakes have it. Our tree boas have pits along their lips, but there's not these two right here. All of the vipers in the Americas have pits. The only vipers we have in the Americas are pit vipers. These top two are terciopellos. These we have around the lake. They're super common. I found 3 of them in the last 10 days. Within 300 meters of the house I'm staying. These other 2 we don't have around the lake. So this one on the bottom left is a bushmaster. It's the longest pit viper in the world. They pretty routinely get 7-8 feet long.
This is a terciopelo we caught that was killed right here. We didn't kill it, our gardener did.
Yeah, so this is about a 5-foot asper, Bothrops asper. That's enough to make your day super complicated. So before you leave, get a good look at that. So bushmasters, you'll hear stories about having bushmasters here around the lake. We don't. We have them north of here and then over across down the Caribbean slope. Right here around the lake, we don't have them. We have another snake that looks like them. We'll talk about that in a second. And then down in the dry lowlands in Guanacaste, we have neotropical rattlesnakes. And that's this guy down here. These guys are absolutely delightful. I love them. As rattlesnakes go, they're pretty mellow. They're easy to deal with. For that matter, bushmasters aren't that hard to deal with either, except that they're huge. Okay, now let's talk about just the pit vipers that are here around the lake. We have 4. Only 4 you got to worry about. The terciopelo we talked about. We'll spend some time on that in a minute. The others, hognose viper. We have one hognose viper around here. It's called Porthidium nasutum. It's a hognose viper that has a hoggy nose. It has a hook nose. It's a ground-dwelling snake. They're super common. They look like dirt. They don't move very much. People get bit by these when they step into leaves. We had a guy down at the other end of the lake, went to pick up a big pile of leaves like this with his hands, and got bit on the finger. Don't do that. That's where these snakes are. Okay, up off the ground, we have eyelash vipers. We'll come back to eyelash vipers and look at them more in a minute. These first 3 are all very common. If you haven't run into them yet, you'll encounter them at some point. The monopiedra, a jumping viper. They are around here, but they're not very common. They become more common at higher altitudes, like at the east end of the lake up in El Castillo. You'll find jumping vipers up there. Here around the lake, they exist, but they're not super common. They're around, but they're not super common.
How far do they jump?
Do they jump at all?
Right.
So jumping vipers are super interesting because they're a little, short, fat snake. I should say little. They about 2.5 feet long is about as big as they get. But they look like a bushmaster that you took and shrunk it down from 7 feet to 3 feet and kept its thickness. So they're a short, fat little snake, except it's not fat. That's 3 or 4 or 5 pounds of muscle with nothing to move but itself. And they have a strike that it's not that far, but it is so fast. There's nothing else that's quite like it. Death adders are pretty fast too, but jumping vipers, their strike is so fast, it's almost like they teleport. It's just so fast. And they do it, when they do, they lunge forward. When they stop, they've got enough momentum in the forward half of their body that it drags the rest of their body along with it. And they'll slide across the ground. They're super fast. They're not super common. We'll talk about snakebite, but of these, the one that you'll need to be concerned about, where some concern is really justified, is these terciopellos. We'll talk more about that. Okay. You hear me? I apologize if I refer to these as aspers or bothrops or something. I'm lazy. It's shorter than terciopello. If I use scientific names, stop me. I do it because some of these snakes don't have good, well-established common names, at least in English. And sometimes I'm lazy and the scientific names are shorter. Okay, so this marking here, you've probably seen some version of this illustration floating around, this A-shaped set of triangles. And you'll see it on the snake out here. You can see it very clearly. You can see it right here on this guy. You can see right there on that guy. This is in the driveway of the brewery. This was in my yard. This is a shed skin. You can even see the pattern there on the shed skin. One of the names the snake goes by in other areas, you hear it called Echis, especially if you go from Panama south. You'll hear the name Echis used, which is, if you view them from the top, the pattern forms something like an X. But then to see it, that X, you've got to be right on top of them where you shouldn't be. So I wanted to give you something to look at from the side that you can see from a distance. This A-shaped marking is diagnostic for terciopellas. Nothing else has it. Okay, A is also for These are big snakes. They're the second biggest viper in the country after Bushmasters. This snake here on the left is probably the largest one I've ever seen. It was exactly 8 feet long. That's dead, by the way. This one here is very alive, by the way. This one is a little over 7 feet long. That's Graven Corrales and Aaron Gutierrez at Clodomiro Picado, where the antivenom is made. This snake, they've got it out. I don't remember what they had it out for, but this is actually too big. They don't even deal with this snake for antivenom. It's too dangerous to handle. So that's where they collect antivenom. They've got plenty of it. They don't. If you don't catch the snakes thinking that they're going to need it, they don't need it. They've got lots of them. But these are big snakes. Don't interact with these things. Please just don't. Most of you probably know who Roy Prentice is. Roy had one of the best descriptions I've ever heard of what it's like to interact with one of these, and he's seen them because I removed one from his driveway. The way he described it is because they are so acrobatic and can move so much more quickly than you can, that they are effectively closer to you than you are to them, if that makes any sense. That if you're 2 or 3 feet away, they're a little bit, effectively, they're a little bit closer than that, and they move in ways that you don't expect them to move. Okay, before we leave that, let's talk about this aggressiveness that you hear about the snake. No snake is aggressive in the sense that it's going to pursue you, or it's interested in biting you, or it's going to come toward you for any malicious purpose. Snakes don't do that. Black mambas don't do that. King cobras and forest cobras will do a nasty charging thing, but they don't chase people. I will sit down. If there's one of these on the ground, I'm perfectly happy to sit down right next to it, a few feet away. But it's not going to approach me. Their behavior is much easier to understand if you think about it in terms of fear. This is a snake that panics really, really quickly. It takes nothing to flip their switch. And while they're not aggressive, they are what I call enthusiastically defensive. Now, that enthusiastically defensive involves some acrobatics that you wouldn't imagine a snake can do. I mean, flipping upside down in the air. They really have an incredible reach. A snake that size, if you were to approach it with a machete or something, it has enough reach to bite somebody Jeff's size in the thigh. So don't do that. It's a bad idea. Their behavior makes a lot of sense if you think of it in terms of panic, which is exactly what they do. They'll sit perfectly still until you touch them, or if you push them with a broom, you squirt them with a hose, and then they flip out. They go from 0 to 100 immediately. They don't have a real intermediate mode.
I have a question.
Yes.
I had one in my yard, and it was like that. It was just very still, and I was far away from it, and I didn't do anything, and I was just looking because I didn't want to get close. But my cat was interested. Mm-hmm. So, would they be aggressive towards a small dog or cat?
They will kill it. Okay, so let me give you an argument that I've never won in my life. I lose this argument every time. Cats, domestic cats, they're not native to this ecosystem. They're not native to any ecosystem for that matter. They didn't evolve here. This ecosystem didn't evolve with them. They are an invasive species. They're one of the few species that hunts for entertainment. So outdoor cats kill a lot of wildlife. They're one of the leading causes of declines and extinctions in birds, lizards, and amphibians. So cat lovers don't like to hear that. They want to have the cats outside. The real answer is, any animal you leave outside is at the mercy of whatever's in the forest. And we have snakes here, we have big cats, we have birds that'll kill cats, for that matter. But yeah, it's a terciopelo anywhere near that size would dispose of a cat quickly. That's the real answer. The real answer is they shouldn't be outside. Cats here should be indoor cats. That's my opinion. Okay. That might be the first time I won that argument. Thank you, guys. Thank you. Okay. Any other questions about terciopelos before we move on? Yes, sir.
So I had somebody, or we had a couple workers, and one of our horses got bit, and they said, "Oh, you need to go find it and kill it because once it's touched or tasted blood." And I was like, "Come on, this can't be true."
Yeah. No. 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 So horses get bit. The problem with livestock, horses and cows, is that they tend to get bit in the face. And where even a good-sized dog, I've seen their dogs weather bites to the faces, and they come out of it and they're okay. Occasionally they might lose an eye or something, but because dogs can breathe, they have a respiratory system built like ours. Their esophagus does dual duty. Horses doesn't. If the horse gets bit in the snout and that airway closes up, they suffocate. They can't breathe through their mouth. So horses, because of their anatomy, are uniquely susceptible to bites by big aspers. Other vipers don't cause quite enough local swelling to be a problem, but the aspers do. Yes?
We have a veranda that has a number of birds' nests that have put themselves there, and I found several.
Bird snakes,
Yeah,
probably.
Small snakes. And probably very stupid, I put a container on top of it and slid it under and threw it out into the woods.
That's if you can do that safely, that's not a bad approach.
I just didn't. I was told that they were there because of the birds and the babies and the eggs.
If you have birds, you have snakes. If you have chickens, you have snakes.
Right.
Absolutely.
If what I did was okay, then if it's as long as it's small. But
yeah.
What else should I do?
If you have if you can identify it as something like a terciopelo, don't get close to it. A garden hose, give it a squirt with a garden hose, a broom. A broom is a good way to make it unwelcome and uncomfortable. It will initially respond to that stimuli, right? If you squirt it with a hose, push it with a broom, it'll lunge at it, it'll do its defensive thing. But it will have gotten the message that it shouldn't be there. So get it a little wound up, get it uncomfortable, and then leave it alone. As soon as it feels like it can, it's going to take off.
Okay.
If you have birds, though, and you have snakes that are going after the birds, the terciopelos will climb when they're very young, but as adults, they're ground-dwelling snakes. The snakes that we always see raiding like oropendula nests, we have a snake called a neotropical bird-eating snake. And they are super common here, and they will go clean those nests out all the time. Yes?
Did you know that eyelash vipers eat hummingbirds?
They do. You are correct. How did you learn that?
Program on YouTube.
All right. All right. YouTube got it right for once. Okay. Yes.
Did you know that?
Yes, I did know that. In fact, now let's move on to eyelash viper. Yeah, one more, and then we'll move on to eyelash vipers. Okay.
Is it true that terciopelos travel in pairs?
No.
People tell me if you kill one, you have to watch for the pair.
Snakes are absolutely antisocial. They don't form pairs. If they're together, they're mating, one is eating the other one, or they just happen to be in an area that they're both comfortable. Snakes are not social animals. That's a super common one. That one occurs all over the world. Yes, one.
Where do the terciopellos mostly hang out? Is there any areas that they like in particular?
They like wet areas of the country from sea level to about 3,000 feet elevation. So we're going to come back to that, but they can essentially be anywhere. For a very nervous snake, they are remarkably comfortable living close to disturbed areas, meaning around houses. I found one in my washroom. Actually, Kenneth found one in our washroom. Actually, you were there, I think, weren't you? Yeah, so we had one in the house. Having terciopellos in the house is not unusual. I had them in the house all the time, but I knew that they were there, and I had them in containers. Free-range terciopellos in the house, I'm as not okay with that as anybody here is. Not okay with that, because their venom is uniquely destructive to tissue. You lose body parts, and it's nasty stuff. Okay, let's talk about eyelash vipers. Eyelash vipers, you thought coral snake coloration was complicated. Eyelash vipers, they come in, so if you go east of here, right, see we're in Aguacate. Aguacate, most of the ones here look about like this. This one actually came from Aguacate. Over on the Caribbean side, you have these kind of gray ones. These are the pink and green ones. South Pacific, they're these spectacular things. This guy was down on the Rodeo Castillo. This is one they call oropel, gold skin. There's some belief that they're extra dangerous or something. They're not, it's just another color. Eyelash vipers are the most variably colored snake in the country. Down around the dam, there's a couple of populations that occur in these colors, but they're striped instead of blotched. They're just about the only thing they all have in common is these eyelashes. They have these pointy scales over their eyes. They are tiny snakes. Biggest wild one I've ever seen was short of 2 feet long. Big ones in captivity that are fed and well cared for might get up to 3 feet. You'll never see a wild one that big. They're typically 1.5 to 2 feet is a good size eyelash viper. They're not very big. Where people get bitten by these is pushing through foliage. You're walking through the forest, you have a branch or something, a bush that's in the way, you go to push that out of the way, you don't see the snake that's in there. They're up, waist high, shoulder high, head high, sometimes a lot higher than that. They're super common snakes. They have a fairly potent venom, but they don't have much of it. They're small snakes. So it is excruciatingly painful. You go to the clinic, you get some antivenom, you'll deal with it. We'll talk more about that later. But they're not a threat to life. Okay. I mentioned earlier that there's a difference between venomous and dangerous. I want to really underscore that. And particularly, you'll hear a lot of talk about what's the most toxic venom, most toxic snake in the country. Well, the most toxic snake here doesn't kill anybody. Those are our coral snakes. Coral snakes, there's no recorded deaths in Costa Rica from coral snakes. For one thing, they don't bite many people. They bite about 5 people a year. And they don't die. They're easy to treat. The venom is slow acting. It's super toxic, but it's not a very complex venom. So they're not a challenging bite to treat, relatively speaking. Dose is very important. This is how I like to illustrate that. Honeybees, they are super common. Everybody been stung by a honeybee? Okay, you've had venom in you that's the same approximate toxicity as a western diamondback rattlesnake. It's about the same level of toxicity, but it's just a tiny, you're dealing with micrograms. Yellow jacket wasps are a little hotter. Those are about the same level as a gaboon viper.
As a who?
A gaboon viper. It's an big African viper. Okay, yellow jackets hurt a little bit more, right? Okay, harvester ants. And that's on the right, that's a black mamba that I'm comparing. You're going to say, God, are you kidding? A harvester ant is as toxic as a black mamba? No. A harvester ant is 3 times as toxic as a black mamba. But that quantity they have is really, really tiny. And so we don't worry about, these are all Hymenoptera. They're all bees, ants, wasps, all in the same order. We don't worry about them even though they have venom that's in that range of toxicity because the amount is so small. Okay, I'll put it in terms everybody can understand. Small snake, big snake. Okay? You have the coral snake. It's more toxic venom, it's more potent, but there's very little of it. You could take a shot of this and, you know, you might feel a little bit, you might not. This is a roughly accurate illustration of the difference in quantity of venom between a coral snake and a large terciopelo. Terciopelo is a fairly toxic venom, but nowhere near as toxic as a coral snake, but there's a lot of it. Okay? You drink 3 bottles of wine, you're going to die. If you drank 3 liters, if you drank that much water, maybe add 1 more bottle, if you drank that much water at one time, you could die. So water is toxic in sufficient quantities. Okay, now this is an interesting one. Terciopelos are, don't worry about these numbers, let's say terciopelos are between 6 and 12 times as toxic as bushmasters, but only about 1% of terciopelo bites are fatal. Bushmasters are much less toxic, but about half their bites are fatal with treatment. Why? Anybody want to take some guess as to what's going on there? The volume. The volume, let's highlight that. They've got a lot more volume. If you get a feeding response from a bushmaster, nobody here will have seen this. A terciopelo is a nervous snake. They'll bite a rat and retreat. They'll bite and let the venom do its thing and they'll get away from it. Bushmasters eat, for their size, relatively small prey, mostly spiny rats. They'll bite those and hold them. So if you get a mistaken feeding response bite from a bushmaster, there's a couple things working to your disadvantage. One, it's probably going to hang on, and you're going to get not just the amount that it can inject in a quick bite, but you're going to get a lot. You're going to get a large quantity of venom. The other thing is that if you're bitten in an area where bushmasters live, that's a primary forest animal. You're a long way from help. And what that venom does is different from what a terciopelo venom. Both of them cause coagulopathy, they cause bleeding, they cause tissue destruction. Bushmasters, their venom tends to cause shock, and it can cause shock fairly quickly. Shock in a clinic is survivable. It's routinely survivable. Shock in the primary forest, you're just going to go to sleep. And you might or might not, sometimes there's a transient shock that happens where your blood pressure drops and it's a pretty peaceful, lights out kind of experience. But then sometimes people come back from it. But if you go into shock and you're out in a primary forest, you're hours from help, you don't have hours. And so those are, even with a much less toxic venom, you get a lot more of it, and what it does is different. Does that make sense?
Yeah.
Okay. Okay.
Ray.
Yes.
My neighbor claimed to have a bushmaster on his property, but it was probably that hog-nosed viper.
It's probably a jumping viper. Yeah.
Jumping.
A jumping viper, probably. You can always send me pictures. And I'm super interested, especially if you have GPS coordinates or you can tell me roughly where it is, because I like to know about where things are found. Jumping vipers in particular, if you get up into the foothills on the north side of the lake here, the higher altitude you go, like up Watusa Road and stuff, up in those areas, you'll get some more jumping vipers up there.
This was on Watusa Road in the bottom subdivision.
Yep. Yep. Okay, yes, one more. And
I've heard that some say that the herpetologist bite twice. Like if you don't get away,
they'll keep biting you. There are some snakes that do tend to bite repeatedly. Terciopelos, if they're wound up enough, sure, they'll bite repeatedly. There's some snakes that almost always do it. Mambas are really are quite well known for just bite. They'll do it repeatedly. Terciopelos, it's not the most common behavior, but yeah, it wouldn't surprise me.
Right, baby snakes. I remember you once saying they keep going or something.
Okay, so let's talk, well, we're going to get to myths, but since you brought it up. How many people have heard the myth that baby snakes are more dangerous than adults? Everybody's heard this. Yeah. It is nonsense. For the same reason, remember the shot glass and that shot glass is a baby terciopelo, the 3 bottles of wine are an adult terciopelo. The myth is that the baby snakes haven't learned to control their venom yet, which is nonsense. They're born with that. It's part of their programming. They come out of the egg or out of the mom with the ability to meter their venom. But even if they didn't, let's say that a baby was always going to give you all it had. All it has is not very much. compared to an adult. So a baby terciopelo might have, let's say, 10, 15 milligrams or microliters of venom. We call it milligrams. 10 to 15 milligrams, tiny, tiny, tiny. You put it in size, a grain or two of rice is about the quantity of venom you're talking about. A 7-foot terciopelo has probably got between 500 and 1,000 microliters of venom. You're talking about a 50 or 100-fold increase in the quantity of venom they have. I would rather get, if I had to get bitten, I'd rather get bitten by something that has as little as possible to start with. A large terciopelo's got plenty, and they're not going to give it all at one time. They can bite you and then bite the next guy. There was a woman down in Uvita. This happens. She walked up to her car. A fairly large terciopelo was curled up under the driver's side door. And she walked out at night in flip-flops. She stepped up the door, put her key in the lock, took a bite in one foot, turned to look, got bit in the other foot, and I'll spare you the detail. Her treatment was not great. They did what's called a fasciotomy, where they slit the skin. They cut her all the way up to the thigh, from her feet to her thigh, for swelling. I don't want to get into that monstrosity of treatment. It is common here. It is not necessary. It's a bad outcome. It took her 6 months to learn to walk again. It was horrible. But to get back to your point, yes, they can bite more than once. No, it's not very common. Once is enough.
Right.
Yes?
How much time do you have when you've been bitten by a snake?
Good. How much time do you have? Generally, hours. It is going to hurt. Any pit viper bites are painful. They really, in the case of a terciopelo, it's digesting tissue. That hurts. So you are incentivized to get to care as quickly as you can, because it's truly mind-boggling pain. But it is going to be, in most people, most healthy adults, it's going to be a number of hours before things really start getting life-threatening. It's not going to be a snake that you drop dead 10 minutes later. That snake doesn't exist.
Enough time to get to Tileron.
To Tileron, absolutely. And I would go to Tileron. And what they will likely do, in a moderate bite, they'll take care of you in Tileron. If it's severe, they'll do what's called drip and ship. They'll get antivenom in you, get you started, get you stable, and move you down to Conyers.
Is antivenom available?
Antivenom is everywhere. Yeah, we have plenty of antivenom.
That's another myth I've heard.
No, antivenom is plentiful here.
People say, they don't have any antivenom.
No, we make it here. It's good. Yes, Yes.
Are you going to talk about dry bites?
Dry bites. This is a good, I'm glad you brought that up. So dry bites happen in some percentage of cases, and a dry bite is defined as any bite where you've been bitten, you have evidence that there is a bite, but the symptoms are usually nothing more than the physical, a puncture wound. You don't really have any pain. There's no swelling or tissue damage or anything. And that happens it happens in some percentage of bites. It is super variable. There are a lot of, we can even use terciopelos. There's a lot of bites where somebody gets a scratch or a glancing bite or something, and it didn't really make good contact, and they've got some pain, and they've got a little bit of local damage, and they may go and get some antivenom, but it ends up, in the scheme of things, not being that severe a bite. It can range from the puncture and nothing else to being dead in 2 or 3 hours, and anything in between. You can have the typical outcome. 99% of the terciopelo bites are survived, but probably 30% of them have some significant tissue damage. That venom does damage. The kidneys might be compromised for some period of time, because as that tissue is destroyed, the part of your body that filters that out is your kidneys. Your kidneys get all clogged up with gunk, with detritus from your body. So yeah, dry bites do happen. With terciopelos and the pit vipers around here, pain is a reasonable indicator. The pain is usually pretty close to instantaneous. It's usually quick. That is not the case with the rattlesnakes down the hill. We get cases frequently where people are bitten by this a neotropical rattlesnake, and it's not immediately painful. And sometimes they even report numbness at the site. But here around the lake, if you're envenomated, it's going to hurt. Yes, sir.
Is tertiopelo venom neurological, necrotic, or what?
No, it's purely it's a necrotizing.
So it is necrotic. It
is super necrotic. It's one of the most necrotic venoms in the snake world. It also causes coagulopathy, so it's hemotoxic and cytotoxic. The cytotoxic means it's toxic to cells, to tissue. It destroys tissue. Most pit viper venoms do both of those things. In the neotropics, neurotoxicity in rattlesnakes is fairly common. Here in Costa Rica, the young neotropical rattlesnakes will have some neurotoxicity. The adults seem to lose that, as far as we can tell. That ontogenic change, that change in venom composition as the snake ages is super common. We don't really have time to get into that, but it does happen. But to answer your question, no, we don't have, around the lake here, none of our vipers are neurotoxic.
Are there species here that are neurotoxic?
Coral snakes. Coral snakes and sea snakes. Yeah. Yeah, one more and let's move on. Yes?
Is there a common factor, the 1% that don't make it? Is it because they haven't got?
What do they have in common?
Or they're young, or they're old, or like what's?
Yeah, so there's a few exacerbating factors. The very young, very old. Very young means very small, right? So somebody who weighs 30 kilos has a different risk profile than somebody who weighs 100 kilos. Somebody who has existing bleeding disorders or heart problems or is otherwise frail health. Any of those things will exacerbate it, and delays to treatment. Delays to treatment are, that's a common ingredient. So if you have one or more of those things going on, you have an older person, compromised health, delay in treatment, that person is really at risk. Okay, let's move on. In Costa Rica, we've got about 500 or 600 venomous bites a year. Here in Costa Rica, we have good data because reporting is mandatory. All the clinics and hospitals have to report it. About 98 or 99% of our bites are pit vipers. Only about 1% of those are fatal. Of the bites that are fatal, almost all of those are terciopelos. About 70 or 80% of the bites that we get from pit vipers are from terciopelos because they're super common, they're quick to bite, they're close to people, people think they gotta kill them, it's a bad idea, good way to get bitten. Only about 1% of the bites are from coral snakes. Coral snakes are just not a public health problem here. Despite having the most toxic venom in the country, nobody gets bitten by them, it's hard to get bit by them. If you get bit by them, they're not hard to treat. You can watch any coral snake from 2 feet away and you're perfectly safe. In fact, usually what I have the classes do is hold your arms out like this. Okay, if you're that far away from any snake in the country, you're that far away from a bushmaster, you're perfectly safe. I'm fairly comfortable at maybe that far from a bushmaster. But if you're that far from any snake in the country, you're absolutely safe. And if the snake is 2 feet long and you're 2 feet away, you have nothing to worry about. Okay. Snake bite in Costa Rica. The red and brown areas are where the snake bites happen. They're the lower altitude rural areas. Obviously, we have a big hole there in the Central Valley because it's a developed area. You have fewer snakes there. But what about Guanacaste? What's going on there? Does anybody have any idea? Those who have been to this, they know it's dry. What do you have in the dry area and not have in the dry area?
The rattlesnakes.
Yeah, the rattlesnakes, and you don't have terciopelos down there. Basically, this bite map is a map of where terciopelos live. I'm being completely serious. It really is a pretty good map of where terciopelos live. Okay. Now, you gentlemen asked about the necrotizing effects of Bothrops asper. This was producer of a TV show called Naked and Afraid. It was down here. Somebody probably heard about this. Stepped over a log, was bitten by a terciopelo. That's what it took from his foot. He had some tissue from his leg and his back that was done to reassemble that foot. It's no fun. All of our snakes here are covered by one of two antivenoms, if there is an antivenom for it. We'll talk about that in a second. All the pit vipers are covered by a polyvalent. That means it's a snake made from the venoms of both Pacific coast and Caribbean coast terciopellos, rattlesnakes, and bushmasters. By extension, that covers other snakes in the same family fairly well, eyelash vipers, hognose vipers. It's got enough cross-reactivity that it'll cover those pretty well. We have the anticoral antivenom that covers all of the tricolored coral snakes. It does not cover the bicolored coral snakes. The black and white one and the black and red one, we don't have any antivenom for those. They don't bite anybody. It's just not much to worry about. Okay, but if you heard about antivenom being in short supply, sometimes people ask about, they've heard about coral snake antivenom is in short supply. For some time in the US, that was true. Here in Costa Rica, we make our own. It's a different antivenom. It's just fine. We've got enough of it.
Right?
Yes?
What if you take the wrong antivenom?
Oh, what if you take the wrong antivenom? It just won't help. Is it going to hurt? I don't want to nerd out too much. The antivenom here, you're probably going to experience, well, you're not going to because nobody's going to get bitten, right? If you were to get bitten, and people I know who have been bitten have been through it, this is a whole IgG antivenom. It comes from horses. And usually about a week or 10 days after you get all this IgG, your immune system wakes up and goes, wait a second, that's not human. And so about a week later, your body starts, it's like a tissue rejection kind of reaction. They call it serum sickness. And it is miserable and can last for 10 days, 2-3 weeks. I know people have been through it. It's miserable. It's better than the snake bite. It's just, so what could happen if you get the wrong antivenom? The worst case is if you got the wrong antivenom and then they had to give you more of the other antivenom. Now you've just got a lot of those antibodies in your body. And your body's not, it's better to have them than to have the venom, but your body's not going to be super happy about them a week later. Actually, that is the other reason that you can't administer antivenom on site. You can't do it at your home because if you happen to have an allergic reaction, that allergic reaction to that will kill you right now. Minutes. It's really quick. So in a clinic, they bring people back from anaphylaxis. It's routine. You get epinephrine, you get an antihistamine. They can keep you breathing. They can intubate you. You can do all kinds of things to keep somebody alive through an anaphylactic episode. If you do that at home or do it in the field, it's too dangerous. Yes, sir.
So I was asking about like those two kinds of antivenoms.
Yes.
Is there one for like animals and humans that are?
There is a veterinary antivenom that's made with, it's the same species. I don't think they now include bushmasters in that, as an antigen for the horses. So it's just rattlesnakes, and I still think either one or two of the populations of terciopellos.
So for dogs or other animals?
It is the same product. It has to meet different safety standards of veterinary. But people have asked, well, if a veterinary product was the only thing available, I would have it administered to me and let them keep me alive through it or whatever else happens. But okay, that's not official advice. That's what I would do. Yes.
Have you heard of the urology, drinking your own urine?
Drinking your own urine. How much time do we have? Okay, it's almost 5 o'clock. Okay, so, okay. In Africa, you're bitten by a saw-scale viper, and you go to a local healer, and he may rub some plant poultice on it. He may cut it, make cuts around it with glass. He may use a black stone on it. They may cut a chicken in half and put that over it, thinking maybe it'll draw toxins out. Here in Costa Rica, one of the things you'll hear about occasionally is an animal's bitten by a snake and they'll inject it with kerosene. So now this poor animal has survived not one but 2 poisonings. Okay, so how do we know whether something works? There's two ways we know whether something works. One is it's been through statistically significant clinical trials with a cohort of treated and untreated people. None of the what is called alternative medicine None of it passes that test. If it ever does pass the test, then it's just called medicine. Okay, so it doesn't pass that test. You get anecdotes where somebody says, "Oh, I was bitten by a terciopelo, and I drank my urine, and I was fine."
No, I'm not saying you're fine, but maybe you can save your life.
No.
Give you time to go to the hospital.
It'll do absolutely positively nothing for you, but leave a bad taste in your mouth. So there's a few reasons for that. We know what the proteins and peptides that make up the toxins in venom. We know what they are. We know what they do to tissue. There's nothing that you can take orally that will address the systemic damage that's being caused by those proteins and peptides. Even if you were to take the antivenom that is grown specifically to those toxins, if you were to drink it, it's destroyed in your digestive system. It doesn't. There's no benefit to it. The other is that with antivenom, we understand exactly how it works. There's an understood mechanism by which it adheres to those toxins, flags them through your body's immune response, and your body can dispose of them. There's all kinds of alternative cures. I got into it a few days ago with somebody in a gardening group about some plant medicine. And there's some real true believers in things like this, and it doesn't work. It doesn't work because there's no way for it to work. There's no mechanism that would work. That's the politest way I can say. No, there's antivenom and there's nothing else right now. Yes.
Can I ask a last question?
Yes.
So in the movies, in the earlier times, in the Western, you were bitten and you see
You
they take a
cut it.
fabric
Yeah.
and they bind it.
Yeah.
And I don't know whether I'm right, but I remember you said that's not a good idea.
That's a super bad idea. If you take a tissue-destroying venom and you lock it into a body part with no circulation for any period of time, you can end up auto-amputating that. And you can find pictures of that where somebody's put a tourniquet around a leg and they lose the leg. No, let's keep it simple. Here in Costa Rica, there's never an indication for a tourniquet. There's never an indication for cutting and sucking venom out. That doesn't work either. Yes?
Is it advised maybe to suck it out or something?
Nope. Because it doesn't. There's components in that venom that are specifically made. As soon as it hits tissue, it disperses immediately. It disperses immediately. You couldn't any more than, let's say, somebody's in the middle of a heroin overdose, where they've injected a lethal dose of heroin. You couldn't put anything in there and suck that out. It's inside the body. What we do know, so this has actually been studied. We did a bunch of tests in pigs on this. What it does do is it causes the local injury to be worse. What it does is all those little capillaries, the blood that's now saturated with these tissue-destroying venoms, it ruptures those. The suction will rupture those. So the local injury gets considerably worse. Okay, I'm going to run over time. Let's crash through these next one, and then we'll wrap up with some Q&A. All right, I told you, I promise you, you're never going to get bitten. To get bitten, you have to be close enough to be bitten. That happens in one of two ways. You interact with a snake accidentally. You go to pick bananas and there's an eyelash viper in it. You leave your shoe outside the brewery. Why you would do that is a mystery to me. But you see there's a snake inside that shoe. Shake your shoes out before you put them on. I have always been religious about taking my shoe. The only thing I'm religious about is checking my shoes. One time I didn't check my socks. And I put my socks on and had a 4-inch scorpion, a bark scorpion, which is, here in Costa Rica, they're not dangerous, but I can tell you the pain is enough to make you want to saw your foot off. It's truly mind-boggling. Check your shoes and your socks. Okay? So you'll never get bitten if you watch where you put your hands and feet. Don't put your hands or feet somewhere you can't see. That includes things like going outside in the dark where you can't see, walking in tall grass and flip-flops where you can't see. There's a lot of scenarios. If grass is more than 2 or 3 inches long, you can have a 2-foot terciopelo in there and you won't be able to see it. Flip-flops are great. I love them. They're comfortable. They're great inside the house. I put boots on to take the trash out here and take a light.
If you have a walking stick, can you just kind of like make sure?
It doesn't hurt.
I mean, will they go away before you get to them?
If you make contact with them, yeah. What I like to have people do is keep a light. Oh, if you go out in the dark, have a light. Make sure you look everywhere your feet go. I don't tend to worry if I'm walking through a pile of leaves or something.
That's what I mean.
I'm not going to do that without boots that are coming up to my knees. You're asking for it. I don't mean that in a bad way, but you're asking for it. So don't put your hands or feet where you can't see. Situations like this, and don't try to catch or kill them. You get close enough when you're trying to interact with the snake. Yes?
Do the snakes around here swim in the lake?
All of them can swim. Very few of them do, but they all can. Okay.
Do they go in the pool?
Oh, all the time. All the time. But what do you have in a pool? In a pool, you've got a net that's on a long pole. You can scoop them out and they're fine.
With rubber boots, is it that they don't sense that you're there, or is it just precautionary?
Ooh, that's a good question. With the rubber boots, do they not sense you there? So the rubber boots do block the heat signature, which triggers pit vipers. So yeah, it blocks that, but also the barrier. So pit vipers, they can bite with a lot of force in that they throw body weight behind it, but their jaw strength is not super strong. The rubber boots are fairly good protection. For that matter, any barrier between you and the snake is valuable. Fangs can go right through jeans, but a bite through jeans is a lot less effective bite than going straight into bare skin. Okay, whatever you do, please send me pictures, anything you find. I always want to hear about it. Don't be these guys. Don't be holding a coral snake and asking what it is. Don't be holding a terciopelo and asking what it is. Don't be holding 2 hognose vipers and asking what they are. These happen. You wouldn't believe how often this happens. So in the snake ID group, we probably get one of these every other week or so. There's somebody holding a snake that they can't identify. I will live the rest of my life and never understand the logic behind that. Anyway, okay, you want to snake-proof your yard? I'm not laughing at you, I'm laughing with you. This is a rural area in the tropics. Snakes live here. We hear people talking about, well, I'm going to kill the snake to make the yard safer. Would you let a child play on the freeway? Of course not. What if you remove 1 car? No, there's lots more cars. You take out 1 terciopelo here, there are plenty, this is where they live, there's plenty of them. You put yourself at risk and there's no real benefit to it. So it's a risk with no benefit. What you can do is get rid of shelter. So if you have grass, keeping the grass short, keeping shrubs trimmed up above ground level so you can see underneath them. Cat food, dog food left outside, that attracts rodents. Rodents attract snakes. If you have chickens or other birds, you have snakes. I probably know everybody with a chicken coop around this lake because I've had to go get terciopelos out of it in the dark, which is not fun. And the last thing, protect your hands and feet. Always, always, always protect your hands and feet. Okay, killing them doesn't work. Special plants, nope, nothing you can plant, nothing you can spread, no spices, no cinnamon, no oregano, no garlic. They don't care. Snake repellent. This is 2 bags of snake repellent with a western diamondback sitting right between them. There's no such thing. They absolutely do not care. Okay, favorite fiction, we've talked about these. Most of the fiction around snakes involves exaggeration. Somebody mentioned with them traveling in pairs. A popular one here is these 2 where boas and terciopelos hybridize. Anybody heard that? And then it produces boas that are venomous but only at night. How that works? Don't know. We talked about baby snakes. we talked about, we didn't talk about snakes whipping people. There's a local myth here that what they call mikas, or whip snakes, can whip people hard enough to break bones. A 2-pound snake can't do that. There's probably a physics class that you can take and fail that leads to the belief that a 2-pound snake can break bones. So whipping with the tail, crocodilians do it, some lizards do it, snakes don't do that. Their tails are not that smart. Exaggeration in size, so fish shrink when you bring out a tape measure, all kinds of things shrink when you bring out a tape measure. Snakes, people say, I've got a 14-foot rattlesnake. Somebody claims to have seen a snake that's twice as big as the largest record of that snake ever. I say, I've never seen that before. Okay, and then the exaggerated danger, the exaggerated speed. I have a couple of snakes here that just took off so fast I couldn't keep up with them, but they're usually doing that in the opposite direction. I have had snakes flee and go right between my feet. If it's coming toward you, it's going somewhere over there. It's not interested in you. You can step aside and let them go by. I've done filming with terciopellos here where I'm down on the ground with them and they're just approaching the camera out of curiosity, and I have to keep backing up, but they're not. If it's going in your direction, there's probably something behind you that it's interested, or what it thinks is its escape route is over there somewhere. They're not interested in you. Okay, that's the favorite fiction. The who you gonna call? This used to be me. Actually, that's the terciopello from Roy's yard. This is also the one that was approaching the camera relentlessly. So we would go out and bag them up. Now, what I hope that most people do is take pictures of them, get them identified. If it is dangerous, call the bomberos, call the fire department. If they're not dangerous, if they're in your house, get a broom, sweep them out. There's really nothing to worry about. If they're in the yard, what do you do with the snake in the yard that you see? Same thing you do with the ones you don't see. Nothing. They're passing through. They'll take off. Okay, that's the end of that. Let's. Thank you. Thank you. Thank you guys so much for being here. This makes it. I love being back here, and this really makes it for me. Yes, ma'am. Let's do questions as long as anybody wants to hang out. Yes.
Mention sea snakes.
Oh, sea snakes. Sea snakes. So sea snakes are elapids. They're in the same family as coral snakes. So sea snakes they're common snakes in the Pacific side. They don't exist in the Caribbean side. Super common. They occasionally wash up on the beach. They are pretty clumsy on land. They get beached and they die there. The bites from sea snakes are super, super rare. There is an antivenom made for them in Australia. We do not stock it here in Costa Rica. It causes a paralysis similar to coral snakes. But you can be kept alive through respiratory paralysis on ventilation and things. Sea snakes, you're not going to get bitten by them because you're not going to pick them up on the beach. If you pick them up, they'll behave like coral snakes. They will turn around and bite you. So don't pick them up. They're beautiful snakes. They're around. Of more concern to me is that they have a myotoxin that breaks down tissue, which causes kidney problems, in addition to the neurotoxin. I've never heard of anybody being bitten by a sea snake here. So, yes, sir.
What's the snake that we think is the fer-de-lance when we look it up?
Oh!
What are we looking at?
There is a snake here called Xenodon rhabdocephalus, or Xenodon angustirostris, if the new name sticks. It's called a false fer-de-lance. You mentioned that I told you two things that I was going to tell you that I didn't tell you. We have no boa constrictors or fer-de-lances here. The name fer-de-lance is French, all right? That refers specifically to a cousin of our terciopellos, Bothrops lanceolatus, in the island of Martinique. That was the original fer-de-lance. Now, the problem with using the name fer-de-lance here is that gringos know it, foreigners know it. It's very common for locals, including local doctors, to not know or not immediately recognize the name fer-de-lance. So if you were to go to a hospital and say I was bitten by a fer-de-lance, they might not immediately be clear on what bit you. if you say terciopelo, every single person in the country knows what a terciopelo is.
But is the one we're seeing, is it venomous?
Oh yeah, it is. So if you call it fertilance, that's fine. To the degree that the common name fertilance, to the degree that it's specific, it refers to a different bothrops in another place. But it has come to be all the lancehead vipers generally are all called fertilances.
It's the one we see
Yep.
display around my house, but
Yep.
they weren't on your statistics for bites.
Terciopelo. A terciopelo is a fertilance. Same snake.
Same.
So what I'm picking at is the name. The fertilance is not, it's not the best common name for them. Terciopelo is universally understood. That's the better common name to use for them. I also told you, I lied earlier and I said that we had no boa constrictors here. We used to have boa constrictors here. But so boa constrictor, boa as a genus, species was a species name. Boa constrictors were one of the few animals that's known by its scientific name. Its scientific name was its common name. So this is common with every dinosaur you know the name of, Triceratops and Tyrannosaurs and pterosaurs and pterodactyls. All those are scientific names. Every microorganism you know the name of, influenza, Ebola, anything like that, anthrax. All of those are common names. Things like iguana and hippo and zebra are either directly related to the common names, or those, gorilla is gorilla. That's the scientific name of a gorilla. So once upon a time, all the boas from Mexico down into South America were under the species called boa constrictor. And the name stuck as a scientific name and as a common name. But then as our knowledge of the species increased and we learned more about them, boa constrictor was broken up into species, where the northern species was boa constrictor imperator, and the southern subspecies in South America was boa constrictor constrictor. And then some more time goes by, and they realize, okay, well, designating these as subspecies doesn't make much sense. These really should be full species. So now, the common boa here is boa imperator, but the common name that stuck is boa constrictor, which now refers to a snake in South America. So now you have a snake whose scientific name is boa imperator, but its common name is a scientific name of a different snake in a different region. It's okay. So when I said there's no boa constrictors, the better name for them here is common boa. They're boas. But boa imperator is what they're properly called now. But if you say boa constrictor, I know what you're talking about. Okay, yes sir.
We have a chicken coop and keep chickens. I've only seen one snake in the last year, but my concern is, by keeping chickens, are we increasing the risk to our neighbors of snakes?
No, you're not going to really be attracting snakes from. They're not coming from. They're not coming from Conyers. You're attracting snakes that are already local to the area. So instead of being in that guy's yard, they're now in your yard. So you might be doing him a favor. Yes, ma'am. Oh, good question. Are snakes territorial? They are territorial in the sense that they have a home range. They're not territorial in the sense of defending territory. Lizards do that, crocodilians do that. Snakes are not territorial in that defensive sense, but they do have home ranges, and there are a number of cases, several of which I've seen, where somebody has moved a snake a couple hundred meters, and it comes back, and a few days later it's back in the same spot. I've seen that twice with eyelash vipers. One that had taken up residence on a propane tank, and so the owner got a stick, moved it out to the forest on the other side of the property, much better location. A week later the snake is back on the propane tank for some reason. I had it happen on my own property there at Green Village. That chain link fence outside the kitchen window, there was an eyelash viper out there on the fence. I thought, that's a terrible place for an eyelash viper. So I went out, got my hook, put it in a bucket, took it to the trees on the other side of the property. 11 days later, that same snake was back in the same spot on the chain link fence. So when you relocate snakes, you don't want to go so far that they're out of their habitat. If you move them out of their habitat, it's essentially a slow death. They'll die. If you move them a very short distance, they might have a favorite spot that they like to hang out and they might return to it. That's a good question. I'm glad you brought that up. Yes?
Do the micas eat the terciopellos?
Ah, okay. Do micas eat terciopellos? So mica is another umbrella name. Generally, so the snakes that are referred to as micas are, so mica tigre, tiger rat snakes, mica pajarero, which is the bird snakes, and then we have a couple of other coroneous species that are also called mica. All mica means is a long skinny snake. So mica means whip snake. The answer is some of them do and most of them don't. Yes?
Does terciopelas prefer a place close to the river? Or go they into the river as well?
The terciopelas, when they're young, primarily eat frogs. So they tend to be close to, at least when they're young, they tend to stay fairly close to water.
But they don't go in?
They can, sure. Oh, absolutely.
Okay.
Absolutely. Yes?
I once found a baby terciopelo in my bedroom. And so it made me research on their reproductive system.
Yeah.
And I learned that they have
lots of babies.
Lots of babies, so I freaked out because I'm like, where is the mummy and where are the brothers and sisters?
Yeah, so if you truly had a newborn in the...
I don't know if it was newborn, but it was...
Yeah, so terciopelas, when they're born, they're between about 12 and 15 inches long. They're about this big. So they do have a lot of babies. So 30 to 40 babies at a time is not uncommon. 50 or 60 happens. It's not common, but it does happen. I do have one anecdote that I can tell you of a house, the house I'm staying in right now. There in Bella Vista, we have an incredible population of coral snakes. I've never seen anything like it. We'll go out and find, in the peak season, we'll find 2 or 3 coral snakes an hour. There are lots of them. So the people who own the house, she called one day, she said, I've got a baby coral snake in the living room. Can you come get it? And I said, sure, I'll be right there. So I went over, got it, bagged it up. As I went out to the truck, she, wait, there's another one. So okay, so I went back in and got another one. And then over the next couple of days, we removed 7 baby coral snakes from the house. So somewhere in that house, we never found it, but there was a clutch of coral snake eggs that had hatched. Terciopelas, I don't worry about that because the female terciopelas of breeding age are big snakes. For them to drop a litter inside of a house, you'd have to have a door open. I mean, they're not going to fit under a doorway. They're big snakes.
I know, but I don't think it was in the house, but...
Could they come in?
Where was the nest? Even if it's outside the house, how the territory? And then how do babies kind of spread and find their own territory?
They just disperse. So here's what actually happens. Let's say you start with 50 babies. 40 of those won't live to see their first year. It's super common for reptiles, thank you, to just never figure out how to eat. They never successfully become predators. Thank you, guys.
Thank you. Great.
They get eaten by birds, they get eaten by other snakes, they get eaten by raccoons or things. But the answer is they disperse. They don't have a little nest that they stay in. By the time you've seen it, they're a mile in all directions.
And then I also read that they have litters, I don't know what to call them, 3 times a year, like not...
Twice a year can happen if the snake is really well fed.
One snake, that's...
They are super, yeah, when I tell people not to kill terciopelos, it's not because terciopelos are an endangered species, it's because trying to kill them is a good way to get bitten. Thank you. You're not going to reduce the population in any meaningful way. You're going to put yourself at risk. It doesn't do any good. Yes?
What are those 2 times a year?
It depends on where you are in the country, but generally spring and fall. Spring is more common when these babies are going to come out. So spring here, well, it would be fall here, I guess. So September, different times of year. So I would get baby terciopelo calls September to November usually. Around the same time baby boas start coming out. by November every year it was raining baby boas. I'd get several calls a day. But I mean, you can see them anytime. Yes?
Do you have a more severe reaction on subsequent bites?
Oh, that is a good question. Do you get... What's that? Yeah, so the question is, do you get more severe reactions on subsequent bites? The answer is complicated. It is possible that you can be sensitized. So, in the same way that, so venoms generally, whether it's coming from a scorpion or a bee or a wasp or a snake, venoms in general are pretty allergenic things. And so once you've been exposed to it, you have a risk that the next time you're exposed to it, you could have a very exaggerated and very dangerous reaction. The good news is, typically that sensitization doesn't happen as a result of bites. It does happen super frequently in venom workers where they're working with venom, they're cleaning cages that have residual venom because they're inhaling it. And venom that is ingested in tiny quantities via your respiratory system seems to be more likely to result in a severe reaction. So I know of a few cases like this, two off the top of my head. One, a guy who was in the film that I mentioned, he was bitten by a fairly, I don't want to say innocuous, but a snake that would not kill you. But he had been sensitized to it and didn't make it up the stairs out of his basement. Thank you. Another guy was bitten by a pygmy rattlesnake, had never been bitten before, but he'd worked with these animals for 30 years, had developed a sensitivity to it and didn't make it out of the snake room. So that when I say that there's no snake that can kill you in minutes, anaphylaxis is a different thing, where a fairly otherwise benign venom, I mean, people react to strawberries and peanuts, and in the same way that a bee sting can kill somebody, it's not a lethal dose of venom, but that anaphylactic reaction can be really dangerous. But generally, as a result of bites, people don't become hypersensitive. Occasionally it happens, but that's not usually. That's a good question, though. Thank you for that. Yes, sir?
Are they seasonally affected, like dry season, rainy season, like as active? You know, in North America in the winter they become very warm.
Yeah.
Is there anything here that changes their activity?
Yeah, so the rain, thank you. So the rainy season, dry season will cause differences in their behavior, largely because it causes difference in their prey behavior. One thing that was super common when I was here is that we had a couple of days of cool, rainy weather, followed by a very warm day or warm night. I knew that my phone was going to ring. So you have a couple of cold, rainy days, and then it's all of a sudden warm, and then both the snakes and the people come out at the same time, and they cross paths. And so that was almost like clockwork. If we had 3 days of cold rain, the first warm, dry day, my phone is, yeah. Yes?
Do the terciopellas, are they out equally during the day and at night?
No, they're nocturnal. They are, occasionally you see them out in the day, in the daylight, but that is, typically they're going to find some place and be camped out during the day. They'll move at night, or they'll come out to a hunting posture at night. So a hunting posture for a terciopello, because they're nervous, they like their back against something. So they'll coil up, and frequently their back will be like against the buttress roots of a tree, or up against a fence, or up against a potted plant or something. They like nothing behind them.
True of all pit vipers?
Yeah, it's true of all pit vipers to a degree, but in terciopellos, they're more nervous than other pit vipers, so they...
I just put the nocturnal part, I'm sorry.
Oh, I'm sorry. The nocturnal, yes, all of our pit vipers are nocturnal.
Is there anything non-nocturnal?
Coral snakes are kind of crepuscular, so they're active at like sunset and sometimes at dawn. Most of the coral snakes I would find would be within like the first hour after sunset. During rain, there's a few species that you will see on the road during pouring, crashing rain. Boas will be out. There's a blunt-headed tree snake that'll be out. There's a snake called Sibone nebulatus, a cloudy snail eater. Those will be out. And terciopellas will be out in the rain. Terciopellas will be out in just crashing rain, and they'll be happily crossing the road. Yeah. Yes.
Can you explain why that is? Is it more their reproductive system in
Probably frogs.
Frogs. Oh,
Yeah.
What snakes like to come up to second-story levels?
Anything that can climb and anything you get an opportunity. So, bird snakes are super adept climbers. Bird snakes will climb anything they can possibly climb. Tiger rat snakes will often show up in the rafters of barns or houses. Eyelash vipers, if the eyelash vipers get up off the ground, you'll find them up in the eaves or up in rafters sometimes. Boas, surprisingly boas, for a big heavy snake, boas are surprisingly good climbers. They'll be up in trees and eat birds and things like that. Occasionally eat a monkey. Those are the ones that I most frequently see up off the ground. Yes, sir.
You said you have hours before it gets dangerous to your life when you get bitten by the terciopello. So
usually.
He was bitten, and he took 28 minutes to get to Tilarán.
Yeah.
And the doctor said this has saved his leg and his life. And any half an hour later, he would have lost his leg or even his life. So it was, and I saw this worker for 2 years recovering his leg.
Yeah.
He didn't have to lose anything. And
did they cut him?
No.
They didn't do a fasciotomy.
But
good.
He was very lucky. He did walk through the grass, and the terciopello bite bit him, but only with one tooth.
Oh, okay.
So he just stepped by and he did only one.
Okay.
Says that this was saving his life. So we know from the hospital that says that everything after 1 hour you will use your hand or your leg.
No. So snake bite treatment, even here where snake bite is relatively common, it is not common for physicians to get a lot of really good high quality training on snake bite. That's how we end up with doctors doing fasciotomies. So we do have an expression that is time is tissue, and especially in a bite with a very destructive venom like a terciopello, time is tissue. Every hour that goes by, you're doing more and more and more damage. I think it's a little hyperbolic to say that in another half an hour you would have been dead from a one fang.
Would have lost his leg.
It's possible, but I would say not likely. Losing a leg is a big body part to lose. And if he'd got antivenom within the, I mean, you could have some damage. He could spend some time learning to walk again. He could lose a good amount of muscle. But losing a leg altogether is not something that happens in minutes. That's a long.
Can you explain how you get to Tilarán, what to call, what to say? Do you have to tell them on 911 something, or what's the way to get to Tilarán?
Yeah, so you don't really have an ambulance service here. So you head straight to Tilarán, call them on the way, call 911, tell them I'm headed to Tilarán, I was bitten by this. Don't bring the snake. Whatever you do, don't bring the snake. Bring a picture, maybe. But if you tell them that you were bitten by terciopello, I have not been in the clinic when it happened, but I've heard of people going in with a bite. They drop everything. If you say you've been bitten by terciopello, they drop everything and everybody gang tackles that patient. So that is about the promptest treatment you're going to get. Yes?
How do you tell a doctor, please don't do a fasciotomy?
Say, I don't consent to this.
You can.
Absolutely, it's your body. You get to say.
And then how would they treat you alternatively if they believe that was the way?
So the outcome of the limb, if you elevate it at 45 degrees and keep the antivenom coming and coming and coming and coming until your blood labs are normal. Your blood labs, your blood tests. Your coagulation is normal. All your blood work is normal. I would just flat out refuse. I would not consent to the procedure.
Is it right to put your feet up?
Yes.
Very high.
As high as you can stand to do it, because one of the things that's going to happen in, especially any pit viper bite, is you're going to get a collection of edema fluid that's going to swell like crazy. The elevation and gravity help drain that edema fluid, and it makes it less painful. That edema is really painful. And if you elevate that, you're going to drain that swelling will go down, and the doctor's desire to do a fasciotomy will be mitigated somewhat.
So once you get bitten, are you recommending you immediately lift your leg if that's where you're bitten?
While you're in transport, I would keep it level. Mostly, the thing, don't disturb it, don't touch it, don't rub it, don't do anything that's going to move that venom into circulation more quickly. But once you get to a hospital and you've got antivenom, then you want the arm or leg, you want it up.
Even though we know we're never going to get bitten.
You're never going to get bitten, so it's nothing to worry about.
Never say never.
Okay. We're running late here, but let's do one more and then we'll wrap it up. Yes, sir. Ice? No. Oh, I'm glad you brought that up. No ice. No taser. No electricity. No tourniquet. Thank you, sir. No, you need a. Thank you for coming. Cell phone, car keys. That's it. Okay. Thank you guys so much.